So now you know a little bit about what it's like to deal with patient assistance programs for you, your doctor, and the consequences of making mistakes or of making the right decisions and being on these and staying on these programs. We talked to Brad a little bit more about SCBN and how they have helped over 15,000 people get over $100 million in medications, and what it's like for a customer who is working with SCBN. So would you say then, when we were talking about cancer victims, women fighting breast cancer, people with brain tumors, people with pancreatic cancer, the list goes on. They're in chemotherapy. A certain part of it needs to be an outpatient medication. They make $800 a month, $1,000, whatever. The drug costs $300, $500, $4,000. Some of these medications and the incomes of these people on, the cost might as well be $1 million because they just don't have it. So they call you. You help them get on the program. Would you say that you saved their lives?
Absolutely. But I'd also say they've helped themselves too. And that's a big point. They've got to take care of their paperwork and get it back to us. They've got to assist us with any documentation or information we need. But yes, we help them save their lives. We're involved in the process together. We're their advocates, but we're partners with these people. We want to help them make sure they live a good life. And yes, we do help them save their own lives, and we do save their lives. We love our patients, and we want them to get their medications, whether it's a blood pressure medication, whether it's a seizure medication, whether it's a cancer medication. But yes, we save a lot of lives. We do this every day, and we do it with people with a number of debilitating diseases, from degenerative disc disorder in their backs, needing extensive pain medications. These people are in unbelievable pain. It's amazing they're able to tolerate such a thing. I know I couldn't. There's certain pain thresholds I can't go to, but I must confess, we save a lot of lives doing what we do, and we make sure we help people who are in tight situations get their medications, improve their quality of life, if not extend their lives for a very long time.
So the patients working with us today, some of them, let's be honest, have gotten their medications, the cancer won. But they got their medications and had a fighting chance. Many of them, their cancer is in remission. They're alive today. Many people on Oxycontin, people on extensive pain medications, their quality of life is improved. Many people, I always remember one lady who told me she mixed cream of wheat with her cat food to eat because she couldn't afford to buy her medications and her food at the same time. We help them to live a higher quality of life, to where they can buy their medications and have disposable income to spend on themselves and their families afterwards. We take care of a range of these folks. But we do charge a fee. We do charge a fee for this. Could you explain why we charge a fee, what our fees are, and what benefit that does to a customer?
Absolutely. Now, we do charge membership dues. This is true. Remember, we don't ever touch medications, so we don't sell them at any time. We only assist as advocates people getting these medications. We charge an average of $20 a month for every program that we work with. Remember, if you have 4 brand name medications and we're able to pre-qualify you for these 4 programs, we're dealing with 4 people. We charge an average of $20 a month for each one of these programs that we work to help you with every month. So in that case, you probably pay an average of $80 a month for assistance with these 4 brand name medications. Now remember what I said earlier. These medications as a brand name are typically almost $100 a month. So many of our patients save hundreds of dollars just a month, just in a month. And we're talking about people on a fixed income of literally somewhere around maybe $1,000 to $1,100 a month. These are minor membership dues for everything that we provide to help them get these medicines, not just in terms of pre-qualifying them, not just taking care of their paperwork, not just taking care of their refills, but solving problems. What happens when a drug is shipped out and something happens to it? We not only work with the patient, we contact the doctor's office, the pharmaceutical company. We'll track down whoever physically delivered it, USPS, FedEx. We will find out what happened to it, and whatever did occur, we will contact the pharmaceutical company and we will find out what we need to send this medication out. These membership dues also pay for the fact you might be denied by the program, in which case we immediately get all of the information together. We find out what this medication is for. We understand your personal case, your personal situation, and who this company is, and what kind of appeals they might take, and we write a personalized letter by your case detailed to the point where we send that back with the application to get them to perhaps overturn what it is they denied you on originally. And I'm glad you asked me that question. We're very successful at that. 99% of the people we sign up get their medications right away within a few weeks after they return the paperwork to us and we forward it on, if everything was given to us as we needed it. Only about 1% of our patients are even denied by these programs. When they send everything back and we write our appeal letter, we are successful 95% of the time in getting the company to allow them onto the program.
So you pre-qualify your patients before you sign them up and charge them $20 a month to get their drugs, right?
Absolutely. The reason we do this is we understand, and we deal with these pharmaceutical companies literally dozens, if not 100 times a day. We understand exactly what their guidelines are. Some are public, some are private, but we've done business with them for so long, and we understand what it is they do and what they consider, so we understand when a patient contacts us with their personal situation, we're able to work with them, understand everything that's going on, and we'll know by what drugs they are. We can match them to programs, and with their information, we can figure out if, yes, they can get on this program, and we can help them do that. So yes, that's exactly how we assist people in getting on board.
So you pre-qualify them so that the patients know that they're most likely going to get the medications before you charge them anything. They know that they're going to get it. It's not just sign up everyone who can and then hope the people who don't, and just, hope that people get approved. It's nothing like that, right? So, but you did say that 99% of the time, which is a high success rate, 1% of people still get denied, and then you have to appeal those. What happens to that 1%?
I'm glad you asked that. And the reason is, we only sign up people we can help. If we fail, and people only pay for our services, our advocacy work on their behalf, if we fail, even though all they paid for was our labor, our work, we refund them if we can't get what they need and they're denied on all appeals. If we simply can't do it, we return their money. In our agreement with our patients, it's almost a warranty that we have. We put it in there that we refund all membership dues for a program that we simply could not get them to send the medication out to the patient. It's always been our agreement. It's always been our warranty to our patients. It's a promise. We refund you if we fail. If you give us everything we need and this company still denies you, we will give you all of your money back.
So sometimes you'll take people's money for membership dues. You have them pre-qualified to what you think is the current guidelines, and on rare occasions, they get denied anyway. I imagine working with 260 plus bureaucracies, it's hard to keep up with everything. Sometimes the information is different than it comes out. For whatever reason, they're going to get denied. You give them all their money back. That's great. Tell me, if you can, a few things that would come up that would make you fail and force you to refund the client's money back.
There's a couple of things that can sometimes happen. One, remember, these pharmaceutical companies, and there are 260 of these patient assistance programs, these bureaucracies, they can change their rules and guidelines at any time. And we've had instances where we've brought a patient on and we've submitted applications, and really in that period of time, the companies just simply changed their guidelines. They've simply changed the guidelines of what they're willing to accept, whether it's financial or whether it's based upon some other form of criteria. And it's terribly unfortunate, but it's outside of our hands. And the patients that this happens to, we explain this to them. They understand that, and we do refund their money. Other examples can happen. Other issues, unexpected denials, simply situations where no one can possibly conceive of it happening, but really the patients have a broad array of different things that they do. Some people are employed. Some people are homeless. We help people that are homeless. Now, it's very difficult, and of all things, you'd very much assume that these would be the easiest people to help. That would be the furthest thing from the truth. Remember, these companies have to send these medications to a physical location. These people have to get in to see a doctor. Well, that's very difficult. Homeless people are in one of the most difficult situations of all, and we've helped a number of homeless people, and it's taken the most amount of effort on our behalf to be able to assist them due to their unique situation. I mean, they don't have a domicile which to send the forms to. There's no way to put all of that information on the forms that require all sorts of personal information that absolutely need a home, a phone number, a way for the companies to possibly contact them at a specific time. Now, this is difficult, but as we do it, we must find a unique way to assist every patient getting on, and we always are able to. If we fail, we do refund their money, but there's simply so many issues that can come up and so many things that can happen. That's one of the great reasons why we're here. If people were doing this on their own and these problems pop up, they would fail. Many of them would. Some might be successful, but many of these people might stop receiving their meds and they might give up. And then what are they doing with their blood pressure? How are they handling their oncology issue? They're not doing anything. We fail, we give you your money back. However, if there's a problem, like I said before, we resolve it at least 95% of the time.